Hello all, we are proceeding with our initiate questions discussion in transfusion medicine, and today's question will be a kind of match the following, a simple but confusing concepts. This question is about a kind of match the following. We have to match the patient's blood group with the corresponding antigens which is present in them. This seems to be a simple question, but it has some basic concepts which can be confused by the examiners. That too, this is an important kind of question which has been asked in previous AIMS questions, and since the recent initiate pattern was mostly AIMS based, this would be helpful for the forthcoming initiate exams also. Looking upon the options are for A positive, O positive, AB negative, Bombay blood group, and the options which are given includes something which might be new for some people, that is H antigen, RHD antigen, which most of us would identify, and something which keeps us confusing between none antigens and all the antigens. Now we'll come to the answer later on. Which on further reactions determines the blood group of a patient. Actually, there is something called as a precursor substance, that is unnamed precursor substance, or that can develop into H substance or Bombay substance, and this H substance is a precursor on which the ABO antigens are determined, and all these are encoded by genes at 3 different loci, that is ABO, H, and SE. The inheritance of this gene, that is H gene, results in the formation of H antigen, and those which lack this inheritance, that is, we can see in this diagram, like if it is capital H or capital H small h, then it will be inherited as H substance. But if there is small h, then those individuals are called to be the Bombay blood group individuals. So these Bombay blood group individuals do not have H antigen. Since there is no H antigen, they cannot form any other antigens like A and B. So that is the basic concept. And this H substance which I talked about will be acted upon different enzymes. Those type of enzyme will determine whether it will form an A antigen or B antigen, or it will remain as the original H antigen. For A antigen to happen, there is an enzyme called as A transferase or N-acetyl galactose amynyl transferase. For B antigen, there is an enzyme called as B transferase or galactosyl transferase enzyme, which on acting upon H antigen will be forming the corresponding enzyme with no function. So for these people, there will be neither A or B antigen which is being produced. So the precursor H substance will remain as such. So this people are called as O individuals, and the expression of RH gene, that will determine whether it is a positive or negative blood group. And we all know that when a particular antigen is expressed in a patient, the corresponding antibody will be absent in them, and this combination we will see for all the blood groups. Okay, now coming upon to the blood group, if they are A positive, negative, we can tell that as if it is positive, then RHD will be there. If it is negative, then no RHD will be there. And the antigens, we all know that A blood group will have A antigen, and the precursor H substance will also be present in some amount in A individuals. So whether it is A positive or A negative, those individuals will also have some amount of H antigen also. And since that A antigen is present, then the opposite antibody will be present in the serum. That is, for A individuals, anti-B will be present in the serum. And we need not remember both antigens or antibodies. We'll like try to understand one, and the other thing will be the vice versa of that. So we'll now concentrate on the antigens part. Now coming upon to the B blood group, similarly like B positive will have B, H and RH D antigen, and B negative will have B and H antigen. Likewise O positive, as I said earlier, H. So there will be only H antigen and RH D antigen, and O negative people will contain only H antigen. And in AB positive, which most of us knows, they have both A, B, H and RHD antigen, and AB negative have A, B and H antigens only. And Bombay blood group, as we saw earlier, they have none of the antigens, not even H. Okay, and the exact opposite is what we see in the antibody in the serum of that patient. So the important places where they will confuse are in Bombay blood group there is no antigens present, and in AB positive individuals there is none antibodies present. Okay, and in some exams they do not go into the deep depth concept of H antigen. So if they blindly ask among the options without Bombay blood group, if they ask which individuals do not have any antigen, we should choose in that place to be O individuals. Okay, so so simple. If they have not talked about H antigen, then the blood group which is not having any antigen is O, and the blood group which is not having any antibody is AB. Okay, now coming upon to our options. Here now we'll try to match it. A positive individuals will contain A antigen, H antigen and RHD antigen. So the answer of A would be 2. And for O positive individuals, we'll try to search for O positive. O matlab they will contain H antigen. So H antigen will be there positive. So we are left with 3, 4 and 5. AB negative. AB means they will contain both A, B and H. So C option will go for option 4. And for Bombay blood group, there will be none of the antigens present. Here they are talking about H antigen. So we should choose Bombay blood group for none of the antigens. So option D will go for number 5. Okay. So that's all for today's discussion. I think it would be an informative session. Thank you all, and keep supporting us. All the best.